abduction and bring back into external rotation. We'll stretch the front of the shoulder in these patients. Okay. Now, we can do with the arm supported, just ask Joe just to hold that position, or we get a sustained stretch. Now, often we don't ask people to hold stretches long enough. To get an effect, you've got to hold the stretch for about 30 seconds. Okay. 2 or 3 times, as a minimum, 2 or 3 times a day. If we're doing 10-second stretches, we're not going to achieve anything. So we could just ask Joe to hold his position there. Now, we're going to come on in a second to utilising eccentric, so lengthening muscle contractions to induce a true change in muscle length. So we've talked about how we can't do that with our hands, but we can do it through exercise. And the way of doing that is by getting Joe doing slow movements. So if you hold there, Joe, and slowly come back to look at the eccentric phase. And hold at the bottom. We'll get a process which we know as sarcomyrogenesis, and we'll talk about it in a second. Good, keep going. That's all. Good, back up. Now, the second one we can do, so if you have a sit, bring your feet on this bed, and then turn the face off the side of the bed. So you stay there. Oh, right, yeah, good. So, good. So what we're looking at doing here, this is a good exercise for if you've got a stiff, painful shoulder, which is not necessarily a frozen shoulder, but you get range. And also very good rotator cuff strengthening exercise. If you rotate down really slowly, as slowly as you can, so you're really increasing the eccentric component of the exercise. Always the bottom, slowly, slowly. Good, hold at the bottom. And bring back up. Hold, and again, stay down. So you get these patients doing these exercises, and I generally say the downward phase has got to be at least 5 seconds. We're doing 5 seconds, 5 reps, with a relatively heavy weight. And if a patient's doing this well, it can take up to 20 minutes to do the exercise. So it might be the only exercise that you give the patient till it gets done well. Can I answer that? Now this is another interesting exercise. If the patient hasn't got any weights at home, you still want to put a lot of load through the shoulder. There you go. You hook this band through here. If you start with this position, okay, so not much tension on the band. We're then going to get Joe to externally rotate, so he's working his posterior cuff actively. Now got a lot of tension on the band. The band is wanting to pull Joe's arm forward. Now if you slowly bring your arm forward, Joe, don't let your arm go slip, but really control it. So you're getting that long eccentric phase on the lower. Okay? And again, this can take a while, a minimum of 5 seconds on the downward phase. And then Joe brings the leg back up, backwards, leg out, and repeat. Okay? Good, and onto your side face.